Nur Syahira, Muhammad Bakar Razi, Stephanie, Akulan, Nicholson, and Hasmin Munira. This gamification project is a requirement under MDJ for 562 Integrated Nursing Theory course, in which our group had discussed regarding the selected content for our games, names of the games, type of the games, and the item needed for the final product. The selected contents for our gamification project was caring for a patient with head injury, including assessing patient neurological status by using Glasgow Coma Scale (GCS). We named the game as Candy Hunt, a puzzle type game. The item needed for our group to build the product and play the games consists of cardboard, plastic wrapper, scissors, candy, sellotapes, glue, and laptop.
So now I'm going to teach you guys on how to play our game called Candy Hunt. So let's go. This game can be played by a single person or a team, depending on the person who conduct the game. Before starting the game, participants will be given a total of 30 candies to be bet on each level of the game. So this game consists of 5 levels, and in each level you have to answer 1 question. So since there are 5 levels, so you have to answer all the 5 questions. The question will be displayed on the laptop, and the participant will be given 1 minute
to discuss and tell us the answer.
Participants are required to bet 5 candies for each question. So there will be 4 answer options, which label A, B, C, and D. So you are going to place your 5 candies on the answer you have chosen earlier. So for example, I have chosen B as my answer. So I will place these 5 candies on the B spot.
The answer will be revealed after 1 minute time. If they bet the wrong answers, all the candies will be taken out. But if they bet it on the right answer, they are able to maintain their candy, and the candy will be returned back to them.
The remaining candy, which includes the candy that you have gained from the previous level, will be brought to the next level. The game is finished when you already completed all the 5 levels and answered all the 5 questions. So the remaining of the candies will be considered as their points in order to determine the final winner. Here's some tips for you guys. Participants are allowed to divide their candies into more than 1 answer options. This is to reduce the probability of getting wrong answers, as you can lose all of your candies. So by doing this, you can at least save some of your candies. For example, if you are confused or do not know the answer, you can place 1 of the candy into each answer option, like this. So even though the candies will be falling, at least you can save some of them. You have to remember that the more candy that you save, the higher the chance of you winning the game. So take note that every candy is precious. This game utilizes the concept of punishment and rewards at the same time. So the candy either can be lost or maintained depending on your answer on each level. So if you get the wrong answer, you might lose some of the candies. But if you get the answer correctly, you might maintain the number of candy that you have. As you go through all the levels in this game, the difficulty of each question will be increased, and it requires more solid and critical thinking to answer and solve the questions. So in that way, it will be more fun and interesting to play. What possible sequence of the responses is assessed in the I components from the highest score to the lowest score? A. Spontaneous, to speech, to pen, and none. B. Spontaneous, none, to pen, and to sound. C. To pen, none, to speech, spontaneous. And D. None, to speech, to pen, and spontaneous. Okay, are you sure?
Yes.
Okay. So I will reveal the answer. So answer D is wrong. Answer C is also wrong. And congratulations, you got the right answer. Assess a male victim who has been thrown from a vehicle. Which assessment finding is most suggestive that he has a serious head injury? A. The accident victim says he had a bad headache. B. The accident victim holds his head with his hands. C. The accident victim has serious damage from his ears. And D. The accident victim asks the nurse what happened.
What is?
Okay, are you sure?
Sure.
So the answer A is wrong. The answer B is wrong. And congrats, the C is the answer. A client was admitted to the ICU after sustaining a closed head injury. Several hours later, the nurse assessed the client is more lethargic and confused, is mumbling her speech, and is very difficult to arouse. The nurse takes action on this assessment for which reason? A. The client's ICP may be decreasing. B. The client is overtired from the events of the day. C. The client is oversedated. And D. The client's brain injury may be worsening.
D.
Are you sure?
Yes.
Okay, the answer is... So A is incorrect. B is also incorrect. So D is the answer. Yeah! So this is the GCS. So the table above shows a client Glasgow coma scale taken by a nurse. The result shows that the client A opened his eyes spontaneously and followed instructions and is orientated. B opens his eye when spoken to, follows instructions and confused. C. Open his eye in response to pain, has no motor response and speak inappropriately. And D. Open his eyes in response to pain, decapitates in response to pain and does not speak.
Berapa minit?
Tengah berjalan.
Jika besar.
Besar juga. Tapi perasaan seorang kau kena
8, 7,
Supposed to be.
6, 5,
Semua lah.
4, 3, 2, 1.
Okay.
So the answer is, so A is incorrect, D is incorrect, so B is the answer. He has a subdural hematoma. Where does the bleeding occur? A. In the brain tissue, B. Between the dura mater and the cranium, C. Between the dura mater and the arachnoid mater, and D. Between the arachnoid spaces.
Antara B dan C. Ha? B eh. B kena bahagi lah. B. A. Kau try A. Lepas tu B. Kau 3 tu kot?
Bagi dua.
Tengok dia jatuh.
Okay, confident with your answer?
Shit tak
Are you
tahu.
sure?
Okay lah.
So the answer is,
Pasal A juga.
so A is incorrect. Next is, D is incorrect. So the answer is C. Watch the patient, they are awake and looking at you. How would you record in the GCS? A. Spontaneous eye opening, B. Orientated, C. Obeying commands, and D. Normal response. Are you sure? Yeah. So the answer is D is incorrect, C is also incorrect, and the answer is A. Woo, congrats! GCS for a patient who is pulseless and apneic. A 2, B 3, C 7, and D is 11. Are you sure?
Yes.
So A is correct, D is incorrect, where's D? And the answer is B. Into the ER after hitting his head in an MBA. He's alert and oriented. Which of the following nursing interventions should be done first? A. Assess full ROM to determine the extent of injuries. B. Call for an immediate chest X-ray. C. Immobilize the client's head and neck. And D. Open the airway with the head tilt chin lift maneuver.
Oops.
So, I'll show the answer. The answer is A is incorrect. B is incorrect. And the answer is yes. That their assessment of a patient's GCS was E2, V3, and M5. How would you interpret this? A. The patient's eye open to sound, they are orientated and able to obey commands. B. The patient's eyes are open to pain, they can utter some words but do not form sentences, and they are able to localize to trapezius pinch. C. The patient's eye opens spontaneously. They are orientated and able to obey commands. And D. The patient's eye opens spontaneously. They are confused and withdrawal from given stimuli or pain.
B.
So the answer is A is incorrect. D is incorrect. And the answer is B. The physician has ordered mannitol IV for a client with a head injury. What should the nurse closely monitor because the client is receiving a monitor? A. Deep tendon reflexes. B. Urine output. C. Level of orientations. D. pulse rate. Confident. So the answer is A is incorrect. D is incorrect. And the answer is
Can you give any feedback for our group?
Okay,
Gamification?
thank you for inviting both of us to join your game. So, the game was very interesting. It has a very unique concept on how you put the GCS topics to the games, and then not that quite competitive. Although they have five different level of questions, but it's quite challenging. So thank you.
Okay, what about the recommendation for us to improve the game?
Maybe you can put more
questions.
questions. Yeah, more questions
Do
too.
you recommend this game to your friend?
Of course. Who don't like to play games, right?
For joining our game today. So can I know your feedback for the game?
So far the game is quite fun because like you're not necessary to put all the candies on there, so at least like you can distribute it. Means like if got wrong, just a few fall down. So
Yeah, it's quite challenging.
yeah.
Do you have any suggestions so that our group can improve our gamification?
My suggestion maybe perhaps like you can not necessary to put 5 candies. Maybe you can put many candies, so it's more total loss. So maybe it makes the game more dramatic. So some people will lose many candies in the middle of the game.
Do you recommend our game to your friend?
Oh yeah, I will recommend to my friends. It's quite fun. Yeah.
Thank you.
왜들 그리 다운돼 있어 뭐가 문제야 say something 분위기가 겁나 싸해 요샌 이런 게 유행인가 왜들 그리 재미없어 아 그건 나도 마찬가지 Tell me what I got to do 급한 대로 블루투스 켜 아무 노래나 일단 틀어